Hi, I'm Annelise, nurse practitioner and clinical advisor here at Feel30. In this video, I'm going to walk you through how to perform a subcutaneous injection of testosterone safely and with confidence. First and foremost, gather all your supplies, your testosterone vial, your syringes, the different types of needles that you'll use, the alcohol wipes, and your sharps container. Wash your hands. Hand sanitizer, soap and water, both are fine. You're gonna pop that plastic covering off of the testosterone and always wipe that rubber stopper with an alcohol wipe before you puncture it with your needle. So grab your syringe and you're gonna grab that bigger gauge needle and attach it, and that's what you will draw up your prescribed dose from the vial. The reason we use that bigger gauge needle is because testosterone is a little bit thicker, so it makes it easier to pull back. Once you've pulled that back, you can remove the vial, place it down, and then with a safety needle, you can just kind of push that covering up. If you have to recap, I always recommend placing it down on the ground so this hand is really stable so we can prevent ourselves from an accidental stick. So when it comes to picking a site for a subcutaneous injection, it has to be an area that has a little bit of fat to pinch. That could be your abdomen, your outer thigh, or maybe the back of the arm, even though it's a little bit harder to inject. So once you replace the needle with the one that you'll actually inject with, you're gonna pinch, wipe with alcohol, and then if you're a little bit on the thinner side, go at a 45-degree angle. If you have a lot more to pinch, 90 degrees is totally fine. The entire length of that needle, and then you'll just push in slowly. Once you've done all of the medication, wait a couple seconds and pull it out. If you miss a dose, if it's in within 24 hours, you can go ahead and take it. If it's been more than 24 hours, skip it and just return to your regular schedule. You never want to double up or increase your dose because you've missed one. If you notice any mild soreness, a lump, or some redness at the site, that's kind of expected when we're injecting ourselves. But if those symptoms persist or if there's something going on that's a little bit unexpected, I want you to reach out to your Feel30 team. I want you to think of like energy to improve within 2 to 4 weeks, things like sexual function and muscle probably in 6 to 8 weeks. You always want to make sure you're storing your vials securely and away from children and pets, and disposing your needles in sharps containers. You never want to reuse them. Remember, if something doesn't feel right, don't adjust your dose yourself. Just reach out to your Feel30 clinical team. They're there to support you every step of the way.